Hi, my name is Kristin Englund, and I'm one of the infectious disease doctors here in the Cleveland area. And I want to talk today about what the goals are of the initiative of ending the HIV epidemic, a plan for America. So HIV has cost America way too much for too long. So since 1981, we have lost 700,000 Americans to HIV. It has cost America $20 billion on direct health expenditures for prevention and for HIV care. And without any kind of an intervention, and despite all of the progress that we have made, we know that 400,000 more Americans will be diagnosed with HIV over the next 10 years. So new diagnoses have gotten significantly better since 1981. And in the 90s, we hit a peak of about 130,000 new patients every year. But by the mid-90s, and as we have progressed over the last decade, those numbers have dropped but have stalled. So we're still at about 35 to 40,000 new cases every single year. The Department of Health and Human Services and the CDC looked across the country to see where most of this was going on. And they found that in 48 counties and in 7 states, including the Washington, D.C. and San Juan, all of those places accounted for 50% or more of the new diagnoses. So if you look in the state of Ohio, one of those little dots is on us, Cuyahoga County. So we became identified as part of the problem, or possibly part of the cure. So we know that early diagnosis of HIV is essential to ending the HIV epidemic. 1 in 2 people with HIV have the virus at least 3 years before they know that they have it. 1 in 4 people have HIV at least 7 years before the diagnosis. So 87% of new HIV infections are transmitted from people who don't even know they have HIV, or at least are not in active treatment. Our treatments, though, are great. Once we get people into care, we know that HIV treatment can be seen as prevention, because if we get a patient undetectable on medications, undetectable equals untransmittable. We also know that we can prevent HIV infection with medications, with PrEP. Unfortunately, though, more than 1 million people who are at risk here in the United States for HIV, only 10% of those are actively on PrEP at this point in time, and we can do better. So the Department of Health and Human Services, along with the CDC, developed 4 key pillars of action for ending the HIV epidemic. First of all, we need to diagnose all people with HIV as early as possible. We need to treat people with HIV rapidly as soon as they're diagnosed and effectively to get to sustained viral suppression. We need to prevent new HIV transmissions and infections by using proven interventions such as PrEP and syringe services programs. Lastly, we need to respond very quickly to HIV outbreaks. So when we see that there are clusters of infections, we need to be able to get boots on the ground to make sure that we're able to identify where these infections are happening and stop them as quickly as possible. So the goals over the next 5 years are to reduce the number of new infections by 75%. And we want to reduce at least by 10 years, we want to reduce the number of infections by 90%. So the first part we're going to focus over is the 75% in the next 5 years in those areas that were noted on a map of the United States. In the next 5 years after that, we're going to disseminate more of those programs that have been effective to the rest of the country to try and decrease the number of new infections by 90%. And finally, in stage 3, as we move on from time after that, we want to try and keep the numbers of new HIV infections down to less than 3,000 per year. That seems pretty miraculous, but what a goal we have. Here are the participating agencies all across our nation. But what we're going to hear about in the next few minutes is what we're doing locally here in Cuyahoga County to make sure that we're doing our part for ending the HIV epidemic. Thank you very much.